Great. All right, Oscar, would you like to kick us off and get us started for today's webinar?
Well, absolutely. And gonna restart the thanks for every time that you give us. And that is truly appreciated for the CQM program and our consultants, Michael and Jamie. We want to reinstate this process because we are creating this culture and you're helping us to build it. Thank you, Piper. I got your emails early. Your email for this project. And the QM project is a test. Remember, we have those devices that are at this point legally, they are signed by the Dallas County. That's a new one. And it will have to be a business agreement with within the provider itself. So it will be it is already a contract signed by the county. County has that. And tomorrow I will review the agreement with Richard, and you will have that contact because it's your IT wants to be safe in that part. And Kathy has some concerns about that. So, I mean, if you don't mind to share that, BAA, well, that'll be great. I can discuss that with Richard tomorrow and we'll get back to you on that. And again, thank you. This is a QI project that is completely new and innovative, not new, but it's innovative for this time. And you're the ones that making it happen. So welcome from the CQM program. And remember, these links are for everyone to visit. And if you have a question, oh, what's the process? Oh, why we said that? Those links are in the website. You can have the list of people, the CQM program, those details, but it take a while to get updated because it's more complicated. It's the Dallas County website, but LPAC formulary is there. The CQM list members are there. But the YouTube channel that we have created and the Glass Cube are the materials that you need, and all the details on recording, supplies, whatever you need is in that toolkit. In Glass Cube, you can find everything you need for this, the forms, the how to fill it out, the tutorial. If you have any question after that, give us a call, even before, during, or after. So we are here to help on that. And don't remember to visit Glass Cube. It's very helpful. And chat in the chat box, please type your name and your organization so we can distribute that later for the groups. And don't forget to mute your site, your end. If you have the phone and the computer, we're gonna create the bounce sound. And if you have your camera, please let us see you. We want to see your face. We want to contact you. We want eye contact. It's very important. If we don't have any face-to-face, like physical present, we want to have your face, your smile. And thanks so much again. Goes to you back. Back to you, Michael.
Fabulous. Thank you so much. And I'm going to turn it over to Regina to remind us how it works for our breakout rooms.
All righty. Good morning, everyone. Thank you again for being with us. As you join the CQM staff, that we're going to actually add extensions onto your name. We're going to put your agency's name on there, and this will allow us to help facilitate assigning you to your appropriate breakout session. And if you would like to add your pronouns he, she, to that, you can please do so. If you get bumped off the call, please rejoin by adding without your agency. If you get disconnected and rejoining your agency name isn't there, please, we will go ahead and add it back on for you. Next slide, please. All righty. And so when it's time for the breakout sessions, we will, you've actually been already assigned to a group. Michael's doing that for us. And we will get a pop-ups like this. If you haven't joined before, it will ask you to click on that and you can say join. You can accept the invitation. And when the time is up within that group, it will notify you as well, and you will be asked to join back into the main group. Now, usually, oftentimes, even if you don't click on it, it'll automatically join you to the yay, happy birthday, Michael. Yeah. And so we'll join you back in. Next slide, please. And I think, is that it for me?
It
All
sure
righty.
is.
Yes, it's back to you guys. Thank you.
Thank you so much. So in terms of our learning objectives for today, we want to look at the materials that have been submitted by you and have a conversation about what we're seeing in the field. In addition, we want to talk about how to prioritize change ideas when the team wants to implement more than one. We've hit on that before, but the principles of adult learning is repetition, and we've been throwing a lot of new stuff at you. So we want to make sure that you understand the different options available to you. We want you to be able to describe the process used to identify whether a change is adopted, adapted, abandoned, and hopefully you'll see that there's a number of resources provided to you to help with that. And we want to have you potentially name the types of change ideas that are being tested based around across the region, after we provide our report and hear more from all of you in the field. It's really important, right, if we're part of a big team project, to be able to say, what's happening and why does this matter? And then finally, explain how QI activities at other local HIV service organizations outside of your own organization add value to your organization and the QI activities that you're pursuing. So it's a couple of different ways, right? This is what we're doing, and this is how we're teaming up with other people or working with other people, or at least in touch with other people, depending on the level of interaction your QI project has for your organization. Now, for the participant toolkit, we'll be discussing this in a couple of moments. In June, we emphasize that there's a lot of change in the air. So with all the changes in the air with the OAs that are ongoing and the CQM performance measurement conversation that we've been having, I think that some of us missed sending in the QI project report form. So we'll be going over that today. And once we hear from you today, we'll be able to put together a toolkit. In the end, these toolkits are based on the information that you submit to us. So you submit what your change ideas are, and we do literature reviews and have conversations with colleagues across the country to be able to provide you with meaningful, timely information. So these toolkits aren't just thrown together, that it's very thoughtfully done, and we'll be able to put this together to support you once we hear more about where you're all at in your stage of your QI projects. So with this, I am going to turn it over to Jamie to be able to walk us through some of our QI process and housekeeping pieces.
Yeah, thanks, Michael, and good morning. Happy Monday, everyone. Yeah, we're going to advance to the next slide. In this section, we're going to talk, it's kind of a bit of a grounding moment, really, to talk about everything that we have available and going on. We have our QI project guide, and a little bit later on in the presentation, we're going to cruise around glass cubes, which is really exciting. There's a lot of good stuff that we've generated so far throughout the launch of this regional QIP project. So if you're finding yourself in your team when we're talking in breakouts, or we're talking about prioritizing, which test of change ideas do we want to do? Just a friendly reminder that there's a lot of assistance in this QI project guide. There's a lot of really great information distilled down that's very, I think, easy to understand, as well as some different tools and templates to assist in the documentation and sort of the tracking, the ideas, the reasons, what we learn, what we like, the unexpected, the good, the bad, the neutral, and all of that. So feel free to utilize that QI project guide. And again, we'll see that a little bit later in class Qs. We can go to the next slide. So one of my favorite things about QI projects is actually the documentation, which sounds really nerdy, I know, but I've really grown quite affectionate because it's an opportunity for change and innovation to more rapidly spread. And part of this is knowing sort of what we're all doing and where we're all at and what we've discovered along the way. So we have a couple of things that the AA has rolled out this year. One of those is the QIP report forms. This is like a Cadillac of report forms. It's really awesome. We just want to remind folks that that's due the first of the month on the months that we have our capacity building sessions. So here we are, it's August, You're going to see later on, we have our next capacity building session in November, and then one also in January. So we'll show you here just in a moment the QIP report forms, AKA the Cadillac form. So this is where you can send those to the AA team. You can send Oscar, Angie, Regina, me, Michael, to the whole group. Or we've created folders for everybody, excuse me, in glass cubes. So we have a couple of different options for what works best for y'all. And of course, TA is available, especially as we're implementing something new, or maybe it's easy to know what's up when we do these sessions, but then, we log off and other things come up and we can't quite remember how do I fill this out, or what do I do with this? So just reach out, TA is available. We can go to the next slide. So this is it. This is the beauty. So this QIP reporting form, again, I really nerd out. I really love this for several reasons. One, it really shows the entirety of a QI project, like the life cycle, where you have your aim, you have your drivers. So you'll see sort of the evolution of your project and the work that your team does and the idea generation. It gives you one space, one home to bake in a robust method. One of the things we're doing with sites as we're walking through these OAs, we get to that QI initiatives piece, right? And that focuses on what's your methodology? How robust is it? How much do people across the team have a shared understanding? So this form is going to help to sort of solidify that space for everybody, for us all collectively as we go together. And it gives you a space to document things like you see your change ideas as they relate to your secondary driver, which supports that primary driver and your aim. So again, I really love this form. It's in Excel, and in the file itself, you have one that's blank for you to fill out for what's relevant to your team and your project and your particular ideas. Then there's also a tab that shows you a completed example. Lower parts of this form have some great resources for performance measurement. And again, this is super helpful because it gives the AA team an idea of sort of what you all are thinking, what you've been working through, and how we're practically applying these QI methodologies and tools that we've been building upon over the last year or so. And then we can share up and share out across agencies in settings like this too. So it's great for for sharing up and sort of the reach of our successes. We can
So
go
for
ahead, Mike.
trivia fans, not only is this a great form, but it's a required form. So we'll be emphasizing this more and more as we work our way through. But we're hoping to and needing to get these from you regularly based on the schedule that was provided on the previous slide. So the first of the month when we have these sessions. Most of you didn't submit them this time, so that's going to be something that we are working with you on to make sure that we can capture this information and complete our tracker, which we'll also be showing you in a few minutes so that you get excited by it.
Yeah, thanks, Michael. So we also have the PDSA form. So that first one was the QIP project, the whole life cycle, right? This PDSA is for your discrete PDSA cycles. This is also an opportunity to control for one of the most common things that we see happen. Scope goes cray, right? So this helps make sure we have discrete small cycle PDSA tested change. These forms would also accompany the QIP, the project lifecycle. So you get the macro and the micro view. Also, just for alignment, for similarity, first of the month on those months. So, we'll want to mark our calendars for November 1st, for January 1st, and then we'll need to figure out what the game plan is in terms of this month and how it relates to what we talked about today. So same methodology, we've got a space in glass cubes available for each and every subrecipient site. We also welcome them via email. And of course, we are here to assist with technical assistance. So let's take a walk in the next slides through this PDSA worksheet. So within this, it's a Word doc, and we have an annotated version, which working with folks across the country, this has turned out to be really, really helpful. So that when you sit down to do it, again, it walks you through, hey, having a baseline gives you something to compare to. And sometimes I think we think to ourselves like, oh, of course we'd have a baseline. Oh, of course. But it often gets overlooked, or it's not documented, or maybe not everybody on the team really actually knows. Only sort of one person knows. So this helps to make sure that this is an effort by all and everybody's operating from the shared understanding. So there's sort of these little like cross checks within this form. So we'll see the PDSA cycle is going to reflect what phase are you in, the P, the D, the S, the A, right? What's your baseline? What's your target? Let's talk about the aim statement. So again, you can do some copy and pasting. Your aim statement is something to be familiar with, to know, easily be able to rattle off, because that's your end point. That's your forward vision, right? So we've baked in a reminder for like what this is, why it matters, and some examples. These don't have to be like, mini novels or anything like that. We appreciate brevity and being succinct. And so that's why some of those examples tease out like, we just need to know what we need to know. And it can be done using brevity. So we can keep cruising. I think there's another one. So then the form also walks through each of those components within the PDSA cycle. Model for improvement are those 3 questions. And a lot of that, what are we trying to do? What are we going to measure? How do we know? A lot of that is reflected in the root cause analysis and the components that are on that QIP, the macro, the big life cycle view Excel form. This one is where we're going to get, again, what are those discrete PDSA cycles? And then we've got some friendly reminders, avoid rushing through the plan stage. Make sure you ask those 3 questions before you move into the PDSA cycle, in terms of saying, who's on the team for this particular tested change. That might ebb and flow. For your discrete PDSA cycles, your team might not be the exact same for each one. So we give you the opportunity to let us know, who's really involved in this discrete PDSA cycle. How do you know this one's going to be a success? And what are you going to try to do, and in what order? Again, there might be sort of a prioritization, which we talked about a little bit in June, and we'll talk more about today through our breakouts and other means. You can go to the next slide. We get to the do. Obviously, this is a little bit more self-explanatory. And the more your project gets integrated into your systems and stuff, it's easier for people to do it, right? That's why these small tests of change are helpful. We'll talk a little bit later in future slides how that eases resistance and how it actually makes things more absorbable, more practical for folks when we do these small tests of change. So again, examples here might include use of existing staff meeting to discuss projects. This is something that we've done through our OAs, right? When we talk about domain B and other stuff, workforce engagement, how much do we really create cultures of quality in our organizations, and how much does communication play into the effectiveness of our CQM program? So again, when we get to the do and studying it, this helps support the work we're also seeing reflected in our OA and our evaluations of our CQM programs. Go ahead.
This is like such an important nuance, I feel, because a lot of times we've already talked about how we get confused between a method, an approach, and a tool, right?
Thank you.
So the method is the model for improvement. The approach that we're taking here are PDSA cycles to test our change, and the tool is this form. So when you think about this, a PDSA, this is for what, this form, this approach, this tool is for, one test of change or one change idea, right? One change idea. And then you think about, if I am implementing continued, there are several things that go into making that happen, right? So those things are what you would list here under number 4. What are you going to try in what order? For thinking about those of you that are working with communication type projects, this is, we have staff meetings, we have email, we have phone, we have Teams, Microsoft Teams, whatever different aspects related to that change idea that you're going to try testing or tweaking or managing. This is about front loading your change, right? It's not about flying by the seat of your pants and just kind of like, I'll do the best I can as I can go. Of course, that's one way to do it, but this approach is really encouraging you to be much more strategic in the way that you plan this. So I just wanted to emphasize that nuance here, in terms of thinking about this form being for one change idea. If you think about that Excel matrix, each one of those change idea pieces on the far right would have their own one of these forms. So I don't want that to be lost in all of the changes that we're bringing to our QI and QM process as a region. It's a really important nuance.
Yeah, thank you for saying that. And, there's a lot of systems thinking in quality. And so I appreciate like showing the interrelatedness. Tools of a system think our mind is that interrelated nature. So recognizing that those individual tests of change have a connection to these discrete PDSA cycles. Again, what's the methodology? What's the approach? What's the tool? That's a really great point. So thank you. So as you get to, when you're within your PDSA, within your tests of change and the ACT, this is a space where a lot of folks detail here is great. That doesn't mean it has to be a whole lot of long sentences by any means like that, but detail here is great. So a lot of times folks will implement a test of change and they might be like, it worked, it didn't, we liked it, we didn't. But this is where some of those like step measures or sort of intermediary pieces of information, what did it teach you? If you implement something that's part of the new process and you get some feedback from clients, oh, this was great, I like this, did 8 out of the 15 say that? Or if you implemented something with clients, again, putting a little bit of data or a little bit of context to it is really important. And this is going to be necessary because part of acting is that adopt, abandon, or adapt. So you need to know why. Why on earth would we keep this as part of our normal sort of standard SOPs? Why did we decide to make this tiny little tweak or shift? Why on earth would we not want to do this? Because down the road, often what happens in quality is folks have a great idea and they sometimes they want to implement like the same version of an idea. And we may have already learned from a PDSA cycle, like that's not what clients want, or that's not what's going to work within our agency. And we forget that, or our memory is short-lived, or there's turnover in new people. So this ACT space really can be helpful so that you can have some fidelity to that sort of adopt, abandon, or adapt kind of decision tree that you'll come across. So as always, as you work your way through the implementation, you're submitting the macro QIP Excel lifecycle project form first of the month. It's accompanied by with your discrete tests of change, these PDSA forms. Anytime you get stuck, anytime you've got a question, you just want to bounce off some ideas, maybe in advance of like the submit or upload to Glass Cubes. We are totally here to support you. This is really exciting. We've never done a regional QIP before. So we're here to support and do whatever we can so that we know the changes that we're making are leading us to the successes that we desire and the impact that we're seeking to have. So feel free to reach out to Regina or Oscar at any time with questions, and we can always set up one-on-one times to discuss the projects, especially if you feel like, oh man, we actually like kind of inadvertently like launched like 2 or 3 tests of change at one time and like what do we do? We're here to help. We can talk through anything. So feel free to reach out for coaching and TA availability.
I'm sorry, real quick, it's important to mention this is new, not just for 1 or 2, for everybody, because this is I don't have any history in files that a common project has been done before. So it will have a lot of tweaking because it's not just moving one element of the 11 subrecipient, it's moving everybody. So thanks for helping us on that and bear with us.
Yeah, and again, we see these as like, to Michael's point, this is required, right? So how do we work with each other leading up to these pieces so that when you send in these forms at the first of the month, knowing that the capacity building session is coming later, you're feeling confident, you're feeling comfortable. The breakouts are an easy opportunity to update, to discuss, and really dive into the peer sharing and, sort of the magic that are network-wide or regional-wide QI projects. So I think, Michael, I don't know if you've made me a host. I can cruise around with Glass Cubes if you want. Let me share my screen. All right, y'all, buckle up. I'm gonna imagine myself in like a flashy red convertible with like some really chic sunglasses and like a silk scarf as I cruise around in Glass Cubes. So let's start with the basics, right? So I'm gonna log in and I'm gonna just kind of drive around as you all would maybe as you log in. I'm going to go to the Dallas Part A, B subrecipients because that is our CQM home. And we want to go to the QIP return to care. So within here, we have a space for our return to care webinar series. So after today, you'll see our capacity building change idea sessions uploaded. We can think back to what we covered in June. So if some of our conversation and breakouts today or other moments of today, you want to kind of go back and remember, that's where you can look to our last session as well as our first. Also within the return to care folder, we have our return to care guiding documents. So this is resource rich friends. We see the QIP project reporting form, which we pulled up just a moment ago in our slides. Again, you see the aim statement. What are we trying to accomplish? Thinking about the model for improvement, looking at our drivers. And then again, where we maybe have a test of change idea, this would be each line would be associated with that PDSA reporting form. We also have the PDSA cycle worksheet with instructions. Again, this is kind of like an annotated version of the document, walking you through each PDSA test of change. So we went over that in the slideshow. We have a planning worksheet. We also have the QIP project charter, a logic model template. Then we have a lot of other sort of cool information in terms of as we are embracing continued or mobile technology, other sort of literature and information about use of tablets and the benefit that that might bring to our organizations. We've also included a glossary of terms and the QI reporting form guide, which I talked about at the top of the Prezi. This is a fantastic resource, again, because it goes through breaking down the model for improvement. And this is really great for, in this journey, you may have new people ebb and flow off your team. Again, this can be really helpful in explaining to them, what are we doing here? What's sort of the context for this? It also helps you walk through those different pieces. So we're going to look at aims in our breakout. Maybe you think, oh, maybe we want to modify or tweak that a little bit. Again, this will assist you with that. It helps you think about your measures, whether they're outcome, like improving retention and care or decreasing, DINCAs, but also maybe some of the process measures that get implemented within these discrete PDSA cycles. So again, utilize this resource to your advantage in terms of also thinking through selecting changes because we're sort of at this stage of the game. So there's some great tips and tricks there for you and the team to look at and work through. We also have some I just went to the return to care guiding documents. So yes, again, we have the webinar series and associated toolkits. We have those sort of guiding documents, including the 2 reporting worksheets. And then we've created the space, as I mentioned, for each subrecipient to have their own QIP 2021 return to care home base. And this is where you can submit on the first of the month. We have capacity building sessions. You can submit the QIP tracker, the Excel doc, and you can submit the PDSA work form, which is that Word doc. Michael or Oscar or Angie, Regina, is there anything else you want me to show folks within Glass Cubes?
Doesn't occur to me like at this moment, but they might have some question like they would like to see something specific they can find or.
I'd like to point out that we're able to manage and see where and when people are accessing Glass Cubes. So I want to make sure we've had some issues with communication, together in light of all of our implementing change together. So we don't want you to think that, I will say we're very much paying attention to this. And so we really encourage you to log in, to look through. If you have additional team members that you think would benefit from being members of Glass Cubes, let us know. We'll send an invite. We'll resend invites too If you lost the one that was sent initially, that's no problem. We can resend it. But the goal here really is to make sure that all of us are, actively using the system, because this is how and where the AA is going to be expecting us to interact on our QI projects. So I just wanted to point out that there is a place for us to go to see who's accessing the site. And if, if we're giving you nudges and bumps about that, it's because we can see that you need the nudge and bump. So don't be, upset if we come and poke you to ask questions about your use of the system, about your submission of forms. We're just trying to make sure that we can all be successful together.
Jonathan, do you have any observation, any question? Have you had any trouble logging in? Or Sandra? All right. So let's move on.
Awesome, thanks. I think I hand it over back to you, Michael.
That's right. Kick me that ball again. The host ball.
Can I ask a quick question while y'all are switching balls?
Yes, please.
Michael, you made a comment that the great kind of guided version of the PDSA cycle planning was blank in the file, but I keep picking up the same kind of guided one. Do I need to just save it and remove all those boxes, or do you actually have a template?
Love that. Yeah, download it, not as a PDF, but download it and open it as an Excel document. You'll see that there are two tabs. One tab is a completed example, and the other tab is the blank one. The blank one may have a couple of little notes in it, but you can just delete them and start over.
Okay, for the PDSA, because I saw that version and was great for the Excel worksheet for reporting form, and the most recent one I'm talking about is the PDSA one.
Yeah, I'll put in the chat. So the PDSA one that's not got the annotated little blue boxes, its title is PDSA Cycle Planning Worksheet.
Worksheet. Okay, I can find that.
But then I'll put which one in the chat is the annotated one too, just so, but that's a great question. We don't want to confuse folks.
Yeah, no, I know it's there somewhere. I just wasn't sure following the breadcrumbs currently. Just
no worries. Okay, so we have a little issue in that Sandra was made the host. So I'm going to need Sandra to make me the host in order to continue the show here. So Sandra, if you can make me the host, that would be really great, please. Okay. And yes.
So I did put in the chat which one is the annotated file name. That's one that says instructions. And then the one that just simply reads PDSA Cycle Planning Worksheet, that's the one that you can, type along and move and groove. Thanks, y'all.
Fabulous. Yeah. So let us know if there's still any issues. When you're done with them and you want to make your report, you can either send them by email to Oscar and Regina, as we've already pointed out, or you can just save them in that report form section, which is probably the best way to go, because then we are absolutely sure to have it. We did do some picking through our emails in order to be able to do this EMA HSDA piece, because, if we're talking about checking emails, we should check our emails too. So we did a very, very thorough job trying to make sure that we have all of your information. But first, let me launch this poll, because I think, okay, first poll we need is this one. So we want to look at just our understanding of the expectations that we have. Since we've just spent some time rolling our way through what we're hoping to get from you. So I understand what's expected of me and my team as we participate in the Return to Care project. The CQM committee receives regular updates on the progress of our Return to Care activities. This is about the importance of stakeholder inclusion. Jamie had emphasized the importance of workforce engagement, domain B, but when we need to think about the organizational assessment and QI dynamics, we're talking about leadership in domain A, we're talking about performance measurement in domain C, we're talking about, QI itself, we're talking about consumer involvement in domain E. So really important for us to think about our stakeholders and how they're involved. And then 3, our QI project team include people beyond our QM committee based on their roles and the changes we are testing. So I just have, I'm gonna wait a couple more moments to see if we get some more folks voting here. Okay, I'm just gonna wait another 5 seconds. Awesome. So let me share the results with you. Looks like we are in good shape in terms of understanding what's expected. Yes. So if you're unsure, let us know. This is an area where, you know, we are looking forward to having ongoing conversations with you. So don't be shy to ask for help or to say like, guys, I don't get this. You know, that's what we're here for, literally. There's no shame in saying, I don't get it. This is unclear to me. So definitely speak up. When it comes to the CQM team being involved, we have a nice bell curve showing here, right? Quite a few folks agree. One strongly agrees. But for those of you who have not been able to involve your CQM committee yet, this is something that we're probably going to explore in the breakout session coming right up in a couple of moments. And then finally, in terms of having folks who are on our QM team, this is another area, a QI team. This is an area that we're going to explore as well when we get into the breakouts, because we should be including more folks, you know, in our project if appropriate. And we know that some of your organizations or your HIV programs are so small that everyone participates in everything. So that's probably the reason for some of the neutrals. But thank you for participating in the poll, and we'll keep going now. So just in terms of a reminder of where we're at, we're in August, right? We're toward the end, hopefully, of identifying our root causes with our stakeholders. And some of us hopefully are already beginning to implement our changes. And we have 2 more sessions left. This is basically the midpoint of our series. So we're hoping that as you implement your changes and you have information to share, that we're going to have a really great cross dialogue by the time we get to November, because you'll have some results. Right? It's one thing to talk about your shoulda, coulda, wouldas and what's planned. It's another thing to talk about what actually happened in concrete terms. And then we'll all have the poster symposium together at the end. Jamie already reminded us of what the model for improvement is. And so I'm not going to spend too much time on this slide, but just remember our methodology is the model for improvement. 3 strategic questions followed by PDSA cycles. And we have different tools to help us at both the micro and the macro sense. And we have a number of different tools that really help us to implement our changes as well. We have different tools that we use in discovery, tools for root causes, and tools for implementation. So we didn't want to have you forget that there are actual concrete things that you can do as well during the implementation of your project. It's not just about what you report to us and, you know, kind of giving us what we need. It's also about us making sure that you have what you need. So again, as you're working your way through these, or if you find other tools that are really helpful or compelling to you as you're working on your project, please let us know. These calls are going to be wonderful places to share those perspectives and, you know, that understanding that you gain as you gain it. So the moment we've been waiting for, let's look at where we are at in terms of our overall implementation. Oscar had mentioned that this is our first time. So this is one of the reasons why we're being gentle with you all and not saying, there are expectations, where are my reports, right? Instead of being hard-nosed from a compliance lens, we are being very open and being very patient with everybody as we work our way forward. That being said, about 1/3 of our subrecipients have not submitted an AIM. This is a huge problem at this point in the project for some folks not to have submitted an AIM. So for those agencies that have not submitted an AIM, we're going to be reaching out to you really soon, you know, and I hope not that we're not annoying, but as we said and have emphasized, it's really important that we all participate in this project. There is absolutely space for all of us to participate in this project. And we don't want to have to talk about compliance and findings at the end of the project if you don't participate now. So alert, 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 please participate. We are trying to throw you bones and to have have you participate and to provide help. But if you don't, then there are consequences at the end. So sorry. We have had one agency that has submitted an aim or shared an aim, I should say, but hasn't taken the next step of doing root causes. But we have a number of folks who have done root causes, and quite a few folks have started coming up with change ideas. One agency is already testing change ideas. So we have a full range of folks here in terms of where we're at in our project, probably the readiness our organization has to participate in our project. And we'll be looking for organizations like Dental, Legacy, Brian's House, Legal, to go ahead and submit their aims so that we can have your full participation in this project. So as we mentioned, we've had a couple of different folks that are working on change ideas and the proposed change ideas. One of the big ones is continued, obviously. But in addition to that, there's a lot of pieces on communication and interacting internally to make sure that we can really coordinate care. Even if it's not something that's super formal within our health record, it's something that's more of an informal touch base with our teams, or a structure to have periodic huddles or periodic debriefs. And those catch-alls that we have for our clients that need a little bit more assistance or help from us in order to make sure that they maintain their care and achieve the great outcomes that we know your care should have them receive. The last one is folks working with surveillance and the government, basically, to help identify where folks are in care. So this is an intriguing thing that the state and the county have offered to work with us and to work together to do this. And a couple of you have taken the state and county up on their offer to do that. So I just wanted to share, we're hoping that this list will beef out significantly as we get more information from folks as they're actually working to test change and to implement change on the ground. Now, fair is fair, right? So we want to make sure that we're re-emphasizing for you everything that the AA is doing. This isn't about someone sitting on a throne being like, you need to give me a report. Where's your report? It's overdue. The AA has been incredibly busy working on a number of projects in its own right related to this overall effort. So thinking about service standards review, a conversation that started last year, making sure that we have clear and consistent service standards as they relate to our ability to keep clients in care consistently. Our collaboration that we've been working with the county and state surveillance on to make sure that things are, that wheel is oiled and that we're not having expectations set into the field that then are not met. As we work with you all, we're wanting to know from you specifically what works and what doesn't work related to this collaboration and this element and this level of the project. So if you are one of those groups submitting lists of your clients to the state or to the county, looking for information on whether or not those clients are in care, let us know that, because we want to make sure that we can help you champion that process and that your requests don't fall by the wayside. In addition to the actual meta kind of macro piece around creating this project, we're doing a lot on the ground. As you know, this webinar series is a major component of the work that we're doing with you all. Reviewing your reports, providing coaching and technical assistance as those reports and requests come in. And then, of course, connecting subrecipients to resources outside of our region. Well, an example of that is that the legal hospice actually has reported that they've had a really hard time working with some of the medical providers in our region. And so they made a request. Hey, how does this work in other areas? Help. So we really appreciate that request coming from the legal hospice. And we've already been able to identify at least 4 different groups in 4 other marketplaces that have really knocked this out of the park, including big cities, small cities, urban, rural, type of perspectives. So we want to make sure that you take advantage of this opportunity. Jamie and I work with people all over the country, cities and states, hospitals, health centers. So there are a lot of different resources that we can connect you with that are probably outside of your own level of knowledge or your sphere of influence. Bring us in, let us help. So I just wanted to park it here to see if there's any discussion about where we're at with the QI project. If there's any, kind of reaction that you have to, who's submitted materials versus not, and, or any reaction to, the work that's ongoing at your own agency as you develop tests of change ideas and tests of change.
I'll highlight the fact that, okay, the comment that Piper is dropping in the chat box is important. You, as a provider, you receive direct the list of people out of care directly from surveillance. So that includes people within dry and white or private insurance or any kind of service that your agency provide. You have a list of people who you serve once and are listed as you as a provider. They'll send you, the person is out of care, they usually send the list. They don't send the list to us because we don't provide services. That's the kind of arrangement we are doing to see how can we tackle that little block. But you, as a staff of your own agency, yes, you have access. And from the CQM perspective, that will be fantastic to have that list coming through you to populate the people out of care to see really what's going on locally.
That's so important, Oscar. Yeah, we've had our hands slapped when we tried to get too involved. So what we can do is make sure that we have our razor sharp poking fingers ready to poke at them to make sure that your requests are met. But those requests won't be completed by us because we don't have access to that information for HIPAA and other requirements. So important. Thank you, Oscar. All right, I'm going to kick it back to Jamie to talk a little bit about our process from root causes to testing changes.
Yeah, thanks, Michael. This is kind of where we hope to be at in terms of the project life cycle. Again, with the established aims and getting into those root causes, we can go ahead if you need to launch the poll. So as we think about these tests of change ideas in relationship to our root cause analysis, we have our first poll question. Our team has identified appropriate/actionable change ideas for testing. Would you strongly agree, kind of neutral on that? You would disagree, or you would strongly disagree? After you've identified or answered that question, then we want to ask folks, we want to know how you would feel with this statement. Our team has prioritized changed ideas based on our root cause analysis. Again, strongly agree, neutral, disagree, or strongly disagree. And then our third question, these are they all kind of evolve out of each other, is our team is ready to share the results of our tests of change with different audiences. Again, same scale between strongly agree, neutral, disagree, or strongly disagree. So even with tests of change, we see, have you identified them? Have you prioritized them? And are you ready to share what's been learned? That's an easy way to kind of compartmentalize when we think of tests of change. So let's check out these results. All right, so this is good. So we have a majority of folks who would agree that they've at least identified appropriate and actionable change ideas. Hey, girl, hey. All right. Then as we think about prioritization, we do have good representation, maybe not quite as much, but we do have a lot of folks who've agreed. We do sort of see a little bit of a different distribution since we have some neutral and disagreed here as well, looking at the idea of prioritizing your change ideas. So again, this is a space where TA is available. Because sometimes, honestly, from firsthand work, sometimes this can be really, really difficult to manage because people's ideas are sort of maybe competing a little bit, or you're just not quite sure where to go next. And then with the third one, there's a little bit of a shift here, and that makes sense. But this is about whether or not those results are ready to share. So another sort of side note benefit of this space is this is a space with our breakouts and things like that, we can practice how do we share these results. So maybe we're not ready to share because we're not done with the test of change cycle. Even still, this can be a great resource for sort of vetting when we do share up and share out what's important, what are maybe things different audiences would want to know, because we get a chance to kind of test that communication in these capacity building sessions. Awesome. So thank you guys for participating in that poll. We can move to the next slide. So I'm kind of curious, these are some different tools that we went over in the June session. So for folks who have like thought about maybe we need to prioritize or better prioritize, or we're not ready to share. Again, these are some tools and resources like the benefit effort matrix, probability and impact exercise, SWOT exercise, voting, and affinity. Not only can these tools help you prioritize and figure out what you're going to do first or next, but these are actually hugely important when it comes to communicating, when it comes to sharing out, because it explains the rationale. It can show teamwork, it can show some diplomacy in terms of why you did what you did. So these are just as valuable for sort of like that third poll question, the sharing of the results. We can go to the next slide. So, okay, this is like one I got really amped about, really excited about. Okay, this is the adopt, adapt, or abandon. So our PDSA discrete sort of test of change cycles, starting small and ramping up. That's the name of the game. Why does it matter? Why do we go over and over and over and over this in quality improvement? Because these small cycles, they're less disruptive. So it's a way to test change more safely. It also allows for simple analysis, right? Sort of short, sweet, to the point, easy to understand, easy to discuss, to inform next steps. It makes smaller next steps possible. Adaptation to change ideas being tested. Adaptation happens, change happens in initial smaller cycles. That's how you're going to set yourself up for success. If you felt burnout before, if you've had trouble before, this is a way to protect against some of those like not pleasant, not fun sort of realities or feelings that we find ourselves in. When you abandon change ideas, this is what you want to do if ideas just show something that's kind of null, like you're not really getting anything out of it, or you want to abandon change ideas that show undesirable results after tweaks. When we think about adopting, you want to adopt those changes that are successful by formalizing them. People get caught in like, okay, well, we're doing it and like it's going well, but like, how does this PDSA cycle ever stop? Like, get me off the merry-go-round. What am I doing here? All right. So the ways you can do that are policy and procedure updates, new workflows, updated training sets, or even updated position descriptions or employee evaluations. Again, these don't have to be like major, massive, organizational, crazy sweeps. It can be some sort of simple change in your workflows or update. You know, there's one more step now in the standard SOP at clinic discharge or something like that. So I love this slide. I hope folks will bookmark this and think back to it as we move forward. We can go to the next slide. And we want to pause for a little bit of discussion based on those test of change questions, kind of those 3 stages, or some of the tools we used, or any questions about adaptation, adopting, abandoning. Just want to hold a little space if folks wanted to discuss anything. If not, I think we can keep moving forward with the rest of the session. Go ahead, Angie.
Okay, I don't see any slides on my end. Alrighty, so it's time for our breakout groups. So we're going to split into 3 groups, and one will be those who are implementing continued. The other will be those one-stop shops, but they're not implementing continued. And then the third group will be those who are going to offer discrete services. So this is your workshop time, so don't hesitate to request additional assistance from us, and especially from our consultants. So don't be shy, and it is a safe place. If you're not, as far along as you'd like to be or as some others, that's okay. Just start where you are. So right now we're gonna send you your invitations. You're gonna click on join to go. And then when it's time to come back, we'll bring you back into the big group.
So I just need 1 second to actually make that happen. That's another challenge with our Zoom environment today. So, okay. Please hold just 1 second.
Well, thank you for being our Zoom captain. I know we all
Yay.
have Zoom burnout, and so we appreciate you. And it's not always easy. So thank you. So yeah, we'll be heading into breakout soon. We've got a facilitator with each and some note takers too, so that we can make the most of this time together. I'm looking forward to these conversations. I couldn't quite remember exactly what the time frame is within the breakouts.
Basically, we have about a little less than half an hour. So, and since we don't have all of the different subrecipients here, what I might do is just merge together groups 2 and 3 and leave them in this room here. So Prism, we're going to put you with Brian's house and the others, if that works for you. And then Jamie, if you and Oscar can tag team the first breakout room, then we should be good. So
Well, do you have a note taker? You feel good if you take the newly merged?
Ooh.
I can go anywhere. Well, just throw me wherever you need me and I'll do whatever.
I'll have Regina come over with me.
Okay. And
So
Piper put a note in the chat for us. Parkland is now in the one-stop shop, not continued group there. I don't know if you got a chance to see that, Michael.
Okay, great. I will take you out then. All right, so HSNT, AHF,
RCT.
and RCD. All right, so I am going to open the room now.
Thank you. See y'all soon.
Now, for those of you that weren't invited to a group, that's because you're staying here with me. Great. All right. So we have Jonathan, Victoria, Piper, and Michelle. Yay. Welcome. It's good to see your face. Thanks for turning on the camera, Jonathan. So a couple of things here. We wanted to talk through the process of just making sure that I have everyone's aims. So I think that this means that Parkland is shifting its aim. I wonder, can we just spend less than a minute each, maybe 30 seconds each, kind of rattling off the aim that we have. And then that way I'll be able to update the tracking form that we have, and we'll be able to manage the conversation a bit better with threads. So Victoria, you are in the center square, Hollywood Squares. And hopefully your Wi-Fi will cooperate, but can you tell us?
I know, everybody keeps freezing. So I don't have my aim statement in front of me because I'm on my tiny little laptop. And everybody's frozen. So hopefully y'all can hear me. So we are looking at, I'm going to turn off my camera. Can y'all hear me still?
Absolutely.
Okay, good. We are looking at, for our aim, we're going to provide the tablets to some of our transgender population, and we're looking at increasing appointment attendance. So therefore we would decrease our no-show. And let's see, is it on there perhaps?
Yes.
Okay. So we want to decrease our no-show rate, and then by that we should increase our viral suppression by 2%. So yes, we want to decrease our no-show rate by 5%. I think we are at about 25%. It may be a little higher for the transgender population. Again, because I'm on my laptop, I don't have all of that in front of me. But we are
That's
hoping
beautiful.
that by giving the tablets to our transgender clients, that it can help target a few issues. It can help with ability to attend appointments by not interfering with work schedules. It will also help to make appointments a little more private. They can use their tablets wherever they are comfortable. So that hopefully will help to increase attendance to appointments. And then, of course, attendance to appointments really does help to increase the number of patients that are virally suppressed. That's kind of where we are.
Fabulous. Thank you for that. Michelle, I don't know. I don't think that I had gotten one from you guys before, but have you thought about this and where you might put your efforts?
Yes. So Brian's house is a little bit different. We provide, care for children that either parents or themselves are infected. So ours is a little bit different. And we are currently working on all of our updating our how we do like intakes and things like that. So for us, I could say it's just different. I don't know what should, everybody's working on such great things, but our program is just different. So we have a hard time as far as we can make changes. It's just to make sure that we're on track with everything,
This makes perfect sense. And what I'm hearing is a request for some TA. And what we can do is have a call with you to basically think about what about your intake? Because what about your intake you're trying to improve, and we can reverse construct an aim, and for groups like yours that serve a very specific, discrete niche role, that's probably what your aim is going to be. It's all about the raison d'etre. That's why you're here, so we're really excited to work with you to think about that. So thanks. As you can see, I noted this request and we'll be following up.
Yes, I spoke to Jamie and we had a really good conversation, and I know she was going to get back with me on a couple of questions that I had. So yes, I've been working with her.
Awesome. Cool beans. All right. Next up, Jonathan, tell me a little bit about your project.
So I'll just tell you, I feel like I've been paying attention to what's been going on, but I don't know when or how we've been asked to report on an aim. So when you mentioned it earlier, was the first time I've even thought about talking about that. So we have an aim, not on paper, but basically our project is working on, and this is what we talked about in the last one, talking about our clients who are returning for their preventive care, because we have a huge focus on preventive care and oral health. And so all of the data that we pulled is related to clients keeping their visits every 3 or 6 months. And we're working on stratifying that data. That's kind of been the biggest issue. And so we're trying to stratify all of our data, because we can tell you how often people show up and we can work on improving that. But we didn't feel that that was all that impactful. We wanted to stratify and see if there are any disparities. Because we've had projects in the past where we've tried to improve show rates, but what we're trying to do is see if there's any specific populations that are having a higher frequency of missed appointments or not keeping their preventive visits. And so we're in the process of stratifying that information, but we're also working on causes and plans for change in the meantime, trying to come up with general ideas on how to contact these patients or how to change our program to help reach out to individual populations. And so we've looked at what kind of data we have available, talked to staff about what they might be able to give us, any ideas that individual staff has on how we can better reach out to patients without taking the only other step that I know of, which is expensive, which is adding more employees, which we just can't do. So that's where we are.
Great. So just quick, since you had mentioned it, we actually did send emails about the AIM, and it was listed as missing deliverables. So we're trying different tools to communicate on this. Just take a look in your email for that. We also did discuss in the June session, and we had a similar table where we were just a little bit more rudimentary. So we're moving it up, and we take the feedback very, very seriously in terms of, if the different ways that we've been communicating don't work, let us know so we can find a better way that meets you and your expectations and where you're at as an organization. Just quickly, Jonathan, it sounds like you also have a request to help generate an AIM. You're languishing in the discovery phase. You're looking at all of the data that you have. So we want to help you to identify quickly how to make some decisions based on what you have instead of continuing to wait, so that we're going to be able to keep you moving along with everybody else in this project. So stay tuned. We'll be reaching out to work with you and your team on this. Piper, tell us a little bit about what you all are working on.
Hi, so we had to switch just because internal barriers with implementing tablets right now with Parkland. Parkland is focused on COVID, and that's it, and I get it. But so we're not going to die on that hill. So we switched hills. So we do have access to Parkland's technology though, and we do have access to a lot of learned lessons from a recently ended SPINS project, and the disparities still remain. So we're going to hone in on men, primarily Black men under 35, and the goal, the statement is, I put it in the chat box. The aim is still a little bit too vague for my comfort, but we're hoping that what this allows is we're a big organization. And so we wanted something that could be structured to where our OAHS team could have some work to do. We have departmental work to do, but then like MCM, NMCM, outreach can all attack different pieces of the puzzle. So we went a little larger for the AIM statement that we hope to then drill down for our personal cycles of change to start to make dents. So hang with us, the bus is taking a big right. First project up is my chart. That's where our telehealth resides. That's what we learned through the exploration with Continued, is that Parkland actually had various pieces with COVID where they were having, what was it, doximity, something like that. They had one version of a telehealth service that the providers could use, and now they've all switched to this internal leveraged telehealth platform, and that you get to everything through my chart at Parkland. And so in our minds, the more we can make it attractive and usable and understandable for our patients, they might experience a lot less frustration in our big system. And that was a big outcome and client need that was expressed from the Village project, from the project that we just ended, was communication, continuity, just knowing, right, being concerned for cost, being concerned, not realizing what Ryan White could provide, by keeping your eligibility up to date. So we're actually in the test phase right now, because we IT did agree to convert our self-attestation form into a MyChart questionnaire. And so we've worked, and that pushes now at the half birth month on day 1. And we're trying to get less people having to come in and do a walk-in with PF, like with our financial counselor. We're trying to remove a step for the patient. So where we started in August, we learned lots of awkward lessons because, IT and any kind of big push, we've already failed a little bit, but it's still better than it was, right? We had like 30% of the 180 that were pushed did it. So September, since a lot of the problems were on our end, so huge admission, it's usually user error. A lot of the problems were on Parkland's end and the IT, the way we built out the push. So September 1, come Wednesday, we're really hopeful that a better, more successful push gets out, and that way our clients can digest information if it's kind of just presentable. So we call it the happy half birthday. So we send them a happy half birthday message. they get this, how easy this questionnaire is complete, and then their financial coverage is updated in Epic, and they can come in for 6 more months of care, and the financial counselor sends them a disposition that your eligibility has been continued, and they don't have to have that concern, and they also can pick up meds, just all of those pieces that sometimes make a client frustrated and feel like they don't have any options. We're hoping to remove that for them. So
I really value that. I think, Parkland takes a lot. Parkland is a great example of an organization that tries, asks hard questions, and if it doesn't work out, you move on and try something else. I think that is, really exciting to see that you've come up with something and have already been testing change. Let's talk a little bit about some of the root cause analysis that's been done for those of you who have identified change ideas. So thinking about, coming back, I'll just go down the list this time. Thinking about what you had shared, Michelle, in terms of identifying the intake, was this something that is a conversation that you've had with clients? Is it a sense that you have? Did you use an actual tool? To kind of process this decision-making point with your clients or with your staff? Talk to me about that briefly. You're muted.
Sorry, can you hear me now?
No worries. Hi, yes, we can.
Okay, so yes, we have discussed it, and I think we are gonna, because things are changing, so we're wanting to do everything where we're not really having so much contact with the client. So it's more of a Zoom and more of filling out paperwork and submitting it through scanned documents, and just trying to work on the privacy of that, of the signatures, and making sure that everything is needed and completed. So that's in the process that we're thinking of going at now, and also changing all of the way we communicate with parents as they're dropping off the children. So less contactless. So just trying to work with different, there's like the Hi Mama app. So there's a whole bunch of things that we're trying and testing to see if that will help our agency. So we're kind of in that stage right now and looking into implement soon. So
wonderful, thank you. Now, Piper, in order to kind of reinvent the process for your change idea and to go ahead and start make these changes, what were some of the root cause analysis tools that you all used?
So we did the good old fashioned fishbone diagram, which then led to the driver. But we had focus groups from the Village project that we had the opportunity to have, as well as we had some pre and post surveys that we had done with about 150 of the clients that we served. So that kind of provided us some resounding, we need this, because we were in the focus groups very intentional about like, what do you consider engaged in care? What's of value to you? What held you back in our care model that we can change, as opposed to what can they fix? What can we as a systems level organization fix?
I love that. I really, really, really love that. And, in terms of thinking about, Jonathan and the dental program is still in the discovery phase. You're very light on your feet with the information that you have available from a quantitative sense. And you added in all of this amazing qualitative richness to that understanding that really helped you and your organization to pull your process along. So I think that is extraordinary. Let's see who is next. All right, so Jonathan, I'm wondering, when you think about the preventive care and keeping visits every 6 months, I think that in June you had discussed this being an issue it's just an issue, but I'm wondering if there was any specific process or tool that you used to come up with the change idea of, focusing on clients to return for preventive care.
Didn't use a tool for that. It was mainly a meeting with me and our clinical team, just discussing what we wanted to focus on. We're planning on doing a meeting with a much wider version of our staff to come up with the change ideas in using one of the, say, fishbone and then prioritization documents that y'all provided.
Fabulous. That sounds like a really solid process, and excited to see how that goes. I'm sure that we'll hear more when we touch base with you. And then finally, Victoria, last but not least, tell me a little bit. I think, you know, since you are the one organization that submitted the form this time, woo! You had definitely done the driver diagram because it was completed. That's the gimme. That's a part of that form. But just curious, were there any other tools or processes that you used at Prism?
So when we started talking about this, and y'all know I kind of came in the middle of this to kind of full responsibility, we really started with data, looked at what groups we felt we really had a strong opportunity, and settled on our transgender patients. And we also have a transgender task force. So we've utilized the task force for lots of good discussion about where their needs and what their patient population needs in order to achieve viral suppression and attend appointments. So we really utilized a lot of the information from the task force and continue to as we walk through this process. We are anxious to get our tablets so we can really start to see, you know, kind of get some good data and some good results. But that's kind of where we are. Yeah, now we're just really trying to work through the getting of the tablet process.
Fabulous. Now, let me see here. Some of these other questions we were going to ask were about your top lessons learned. So I don't know, we only have a couple of minutes left before we have to go back to the main room. I'm wondering if anyone just wants to kind of volunteer lessons learned so far. It sounds like a couple of you had some lessons.
I would be happy to share just a quick, as applicable to the AA and the expectations of the QIP, it's actually been helpful to have the expectation from the AA, right? To push some of the conversations forward. Like, I know we're very centric on this issue, but we also have these deliverables. So, hey, we're already thinking about these things. Let's tie it back, and then we can meet obligations to AA as well as our internal obligations, as well as PHHS, like that realizing the expectation, you know, that's why our organization, it was great when we joined in disparities. And at the same time we did that, having the AA launch and really rebrand and refocus their CQM efforts, it helps to have that leverage, push and pull. And it changes the conversation, I think, internally as well as with the AA.
Thanks for that. Dust in the air can definitely, you know, clog the sinuses, but can also like be a sign of positive motion. As long as we're all, you know, communicating, making sure that we're all heading in the right direction, and that you don't let us go too far afield, you know, beyond readiness or capability. Some of you with a team of 3, I mean, what are you going to do, right? So we see that and we understand that, and we're here for you and with you as well. Any other lessons before we jump back to the other room?
Hi, Michael. This is Sandra. I'm from AIDS Healthcare Foundation.
Hi.
I've been listening, but I guess we ended up not sharing. But if I can briefly talk about where we are.
Yeah, I'm so sorry. I thought you were supposed to be in the other room. I'm sorry.
No, we are planning to do continued as well. So anyway, so I think our aim, I don't have my aim like right in front of me, but I think it's in the realm of annual retention rate, increasing it by I think 3%. And what we're doing is we had a back to care campaign that was organization wide that we've adopted for this project. And so one of the things we did in the last couple of months is look at the list of our consumers that have not been at the health center in the last 13 months. And actually, now that we have AIN working with AHF, we compared our list to theirs.
Right. Oh, great.
Oh, that was Jimmy.
Everyone just came back in.
Everyone
That's okay.
just came back, so that's why I stopped talking.
Oh, no worries. So just so that everyone else can see, one of the things that we have been putting together is a tracking form, really to be able to describe at a high level what's happening across our agencies. So I don't know, Regina, if you want to provide a quick debrief. We only have like a minute each for the debriefs, but if you could provide a quick debrief on what we heard in our session.
Okay, so briefly, we heard that what we did find out, a couple of agencies have they've developed their aim statements. We have a couple that are going to need some technical assistance on developing their aim statement because of the uniqueness of their programs. Let's see, and then root cause analysis were done. Some did fishbone. We had a couple do the fishbone. Some just met to just talk about it. And then with lessons learned, quite a few lessons learned, revamping systems, revamping how you roll out. And, you know, we talk about briefly talked about user error most oftentimes, but then it can be systems errors as well that take place and have to be revamped. Was that a minute?
Thank you. That's fabulous.
Okay.
Who took notes for Jamie's group and Oscar's group?
I took some notes. We had one who had done a fishbone diagram, and one who is not sure about hadn't done a process map, but kind of late to the game, but on pace with
Mr. Walker, when you're here at our office now.
And then we had one
okay, I'm gonna come out and talk to you. If you had it.
We didn't get to hear a lot about, but one who are in the process of trying to figure out how to do things. They have their different locations. So they're working with their staff to implement everything where they are here in Dallas. So kind of different spots. Everybody's kind of in different places, but it looks like everybody is moving.
So exciting, right? Because that's the whole purpose of this project. And, you know, we're all moving toward together and forward together and trying to move toward, you know, a system that has better retention and care and endpoint HIV health outcomes. So we are excited to, you know, make calls to those of you who have requests in, or, you know, since Legacy and Legal weren't here, we're gonna go ahead and just kind of work our way into there as well to see how we can assist them. And we're also going to be following up to see if we can get some of you to just share with us where you're at with your project. You know, since we're all standing this up together, I think that the important thing is trying. You know, just try it out, try the form, fill out something and send it to us, you know, and that's enough. That's enough. But what's not enough is to say, this doesn't work for us. So we're going to end up working with all of you to make sure that we can keep you in Camp A and out of Camp B. All right, so just in closing, because I know that we are a little bit over now. Whoop. Let me see if I can kick it over to Angie to close us out and share with us what we're doing for our action planning this time. And you may be muted.
I'm sorry, I am muted. So we're talking about right now, this slide right here. Are we talking about our next?
This slide for the action planning, because remember, we have our Microsoft Word document that you can work through with your team to actually make this happen and to help your next steps flesh for you, so that we don't get to October and you're like, oh no.
Okay, so let's work on it moving forward. When testing changes, how are you looking? How are you documenting your progress towards your aim? Because we know a lot of work is happening, but we're not capturing everything. So be sure to write everything down, and how we're prioritizing our competing tests of change. How do you work with others outside your organization to test change, if at all? Are you working with county, state surveillance and testing changes? How are you planning to formalize changes that led to improvements in performance? How do you shift from one change idea to the next? What process will you use to adapt your aim if you achieve it earlier than expected? So those are all things to keep in mind as we move forward in our action planning.
Yeah, it's a little bit more than we normally have, right? We normally only have about 4 key questions, but when you think about these key questions, a lot of them are kind of yes and no, right? You know, and then maybe a sentence that kind of like a little bit more than just the yes or no, you know, that the how piece in particular. But I think it's really important to think concretely about the QI project life cycle, where we're at in the life cycle, and how your team should have a structured process in place to make sure that you can, you know, bring yourself to a good place in the end. So I think that we are over time. So I'll just kind of quickly zip through, you know, these last couple of slides. We have our next session on healthcare neighborhoods in November. And again, that's where we're hoping to have information from you on the results of your tests of change so that we can start making concrete connections between your learnings as organizations that aggregate to our learnings as a system. And then finally, we're going to each have a poster in January where we have a chance to kind of walk through what this process was like. We're going to talk about the good, the bad, and the ugly, and the AA will have a poster as well. So it's going to be really exciting to share, you know, all these perspectives in an academic way that also then helps us to prepare to submit that sucker to a conference already done, out of the way. So that's the name of the game. That's the goal. And we are really grateful for your participation. Just a reminder, we should be moving into implementing changes. And it was great to hear from some of you and to get requests from you in our breakouts on where we can actually help you to make sure that you're at the right place at this time. So Dr. Salinas, I don't know if there's any final words for the day.
Real quick, I just want to thanks again for those who take serious the serious matter, which is CQM. This is a game changer. So for those who are not taking it that like serious, will be a wake-up call this week. But please, thank you again. Encourage the people that you have around that this is something revamping, new, learning. Is, by the way, it's academic as well, so which is great. And you are the main players of this. Our consultants guide us. You are the main players of this stuff. We'll be taking the boat after they leave, but this is gonna work thanks to you. Thank you.
Fabulous. Thanks so much, everyone, and have a great rest of your day.
Thank you, everyone.
Thank
Talk
you,
soon.
everybody. Have a great week.
Thank you.